Medical technology and how it has changed since the Civil War. Medical technology has changed dramatically from the Civil War era to present day. We now have better medical supplies, better medical training, and a better understanding of diseases and how they spread. Physicians in the Civil War had very basic medical supplies. Surgery was often performed with tools that looked as if they were from a hardware store on a primitive operating surface, such as a door or a dining table. Here, a surgeon's operating kit is shown, including a bone saw and resecting knives for amputating limbs and removing bullets. Physicians had very few medicines that actually worked, and the ones that did were often used incorrectly and/or were misunderstood. These medicines included paregoric, quinine, and chloroform ether, which were used for pain management. Ambulances of the Civil War were simply horse-drawn carriages used to transport wounded soldiers to field hospitals. They were a slow and dirty method of transport. Thankfully, we no longer are faced with these problems. Numerous advancements in the area of medical supplies have been made since the time of the war. Physicians are now equipped with specialized medicines and advanced operating tools, such as the scalpel. Computer technology has also entered the medical scene, allowing scientists to invent diagnostic tools such as the MRI, magnetic resonance imaging, X-rays, and CAT scans, to name a few diagnostic tools of today. Instruments of today's surgical suites are highly advanced and even include robotic surgery. Physicians in the Civil War were undertrained, with virtually no technology to assist their learning. Students simply listened to lectures and read books for about 2 years before becoming an apprentice to a practicing physician. They had no technological assistance in their training and rarely learned anything hands-on. Many had never even seen the inside of a human body before the war. Today, however, medical school training includes hands-on learning every day. Cadavers are used to learn anatomy and physiology, and highly technological scans of the human body can be used to educate students. Teaching is done with the help of modern technology, as well as from textbooks, as in the days before the Civil War. Students of medicine today study and train for 4 years after college, and most likely they train even longer in a specialty area like cardiology, orthopedics, general surgery, etc. All through their education, learning from books as well as the advancements made possible by advanced technology. A lack of technology also left Civil War doctors in the dark when it came to understanding diseases. The lack of experimental research meant that they could not prevent or understand how diseases spread. In fact, more soldiers died of disease and infection than from direct battlefield wounds. Doctors had not made the connection between personal hygiene, sanitation, and cleanliness to prevent diseases. Their lack of knowledge led to many soldiers dying in field hospitals, the dirtiest part of the medical system. Infections were very common and spread through the whole body very quickly, leaving surgeons with no option other than amputation. Amputation was very bloody and fast, taking an average surgeon only 3 to 4 minutes. Doctors rarely cleaned their instruments or even washed their hands as they moved from patient to patient, unknowingly spreading disease and infection. Today, operating rooms, instruments, doctors, nurses, and even the patient are sterile before the start of the surgery. The United States Sanitary Commission was formed during the Civil War, which tried to educate Americans about the importance of personal hygiene and proper waste disposal in the prevention and spread of disease. Overall, the lack of research in sanitation technologies led to many problems for soldiers of the Civil War. Today, sewers, showers, and even toilets are technological advancements. We now understand the importance of personal hygiene and proper waste management to prevent the spread of disease. Even a precaution such as washing your hands is a great improvement over the practice of the Civil War medical personnel. As you can see, when it comes to medical technology, change is a good thing.